Hello all. Today I'll be discussing about allergic rhinitis. This is not a diagnosis of rarity. This is a very common disease, and it has been seen that the patients who have allergic rhinitis do end up with bronchial asthma. They have a higher chance of getting bronchial asthma. So in this video, I will discuss how one ends up with allergic rhinitis, what are the treatment options available to alleviate the symptoms, and also the precautions that we can take at home to avoid the triggers. So a patient with allergic rhinitis can have bilateral nasal stuffiness. Along with that, the patient can have facial, nasal, and eyes and throat itching, recurrent sore throat, bad breath, fatiguability, and also the patient can have fluid collection in the ear. But if your symptoms are limited to one nose with bleeding, foul smell discharge coming, then that is not likely to be allergic rhinitis. That needs to be further evaluated. The kids of the parents who already had allergy or asthma or any atopic or skin rashes, the kids have 3 to 6 times more chance of getting allergic rhinitis or features of allergy. So there's a hypothesis known as hygiene hypothesis, in which it has been postulated that in areas where infectious diseases are very less, or where parasitic infestations per se in a kid or adults is very less, they are the population who are more prone to develop allergic features. Like it has been observed, kids who are born and brought up in villages, who have been exposed to livestock and who have had multiple infections, they don't land up with allergic diseases. It is just a hypothesis. It has not been proven to be 100% true. And also, the kids who have not been adequately breastfed, who have had bottle fed, are also predisposed to getting allergic features in future. If someone wakes up with a stuffed nose and itchy eyes and face or nose, that means that person might be allergic to the dust mite which is accumulated in the bed. Or if the person is having excess of itching in the eyes and sneezing and stuffy nose during the summer time, it is more likely that the person might be allergic to the pollen which is released in the environment. Then investigations are RAST, that is radio allergen absorbent test, and also skin prick testing. Skin prick testing is done in a specialist clinic. The details of those tests I am not discussing here. So this is generally to help us find out if you are having allergy to particular allergens, and if we are able to find out those allergens, then we can start you on immunotherapy. This is for the patients who do not gain with any medical therapy which has been started initially. So what are the treatment options available in front of us? So first is to avoid the allergen. Next is pharmacological agents which will help you control your symptoms but does not cure your diseases. Next is immunotherapy, surgical options, and also some other complementary treatment options. So how to get rid of your allergens? For that, first you should identify what are the common allergens in indoors and outdoors. Outdoors, most common is the pollen. Indoors, it can be cockroach, moles, dust mites, your furry pets, that's cats and dogs. These are the most common indoor allergens. So how do you control or at least alleviate to some extent these allergens which are present indoors? For this dust mites, what you can do is you can wash your beddings at 55 to 60 degrees Celsius water once in 1 or 2 weeks. And also you can cover your pillows and mattresses with covers which has a pore size less than or equal to 6 micrometer. Then other options that you have is you can avoid using curtains and wallpapers at home, which will help in reducing the dust accumulation in the room, and avoid soft toys from your bedroom, avoid soft cushions from your bedroom, and in places, if possible, use leather or vinyl coating for your cushions. And also use a very good vacuum cleaner to clean your cushions and upholsteries. And how to get rid of cockroach allergens? You have to get rid of the cockroach with all pesticides available to us, and also seal the cracks in the floor and ceilings. And also you can use detergent to scrub off the allergens of these cockroaches once you get rid of them. The other way to get rid of moles is to keep the air conditioners are working and to immediately repair if there is any leak in your washroom or. And also you can wash your floorings in the bathroom with 5% ammonia to get rid of the moles which are growing on them. Among pharmacological agents, intranasal steroids are most effective in controlling all the symptoms of allergic rhinitis, mainly if you have a stuffy nose. If you also have a itchy nose and excess sneezing, then antihistamines are also effective. They are also come in spray form, and there's a combination of the steroid and antihistamines together which can be used for long term. There are very minimal side effects for steroid nasal spray. As far as studies have been conducted, the only side effect which is documented because of because of steroid nasal spray use is only epistaxis, that is nasal bleeding, and that also if you're using it in a faulty way. If the nozzle is continuously hitting your nose each time you instill the spray, that can lead to nasal bleeding. Then saline nasal washing or nasal douching can help physically can remove the allergens from your nasal cavity. So what happens in immunotherapy? In immunotherapy, once we have identified that you are allergic to particular items, that particular item can be injected to under your skin subcutaneously, or it is given sublingually, just under your tongue it is kept. And this treatment has to be continued for a duration of 3 years. I'm not going into further details of immunotherapy, that I can take in the next session. For children, they might not always have all the features of allergic rhinitis, but if the nasal block is associated with itching, which is lasting for a week or so, then one should consider the child to be having allergic rhinitis. For them, we can start them on oral tablets, antihistamines, and also leukotriene receptor antagonist. So these two, a trial can be given for a long term. These two have better results on long term, and the child also has a good option of steroid nasal spray. If the child doesn't tolerate steroid nasal spray, the child can always be started on oral antihistamines, and these have very minimal side effects.
So with this, I conclude my video. I hope it was informative for you all. You can share your comments and your queries in the comment section below. Thank you.